Patient Access to Provider Notes, College of Nursing, University of Hartford, by Jesse Finkelstein. Here we have my thesis statement. So patient access to the provider notes has been linked to overall improved patient care. With all new technology, there are risks involved. Although there are some risks, the overall benefits of patients' real-time access to their electronic health record and narrative provider notes outweigh those risks. So here are my objectives. So we're essentially exploring the hesitation by stakeholders, the benefits of the EHR, clinical transparency benefits, the ethical impacts on adolescent patients, as well as the impact on mental health care, and exploring how clinical decision support systems can be utilized within the EHR. So here I have the stakeholders hesitancy. I have three stakeholders: the provider, the patient, and healthcare leaders. And so the provider's fears being offending the patients, impacting workflow, straining the patient-client relationship, and confusing patients with medical jargon, so abbreviations, big words. The patient fears obviously being their privacy concerns, being seen as difficult when bringing up what's written in the notes, and the public health leaders' fears of increasing this digital divide among populations, really creating even more inequities when we're trying to make healthcare equitable. So here we have the benefits of the EHR, and so that's utilizing it has been shown to decrease hospital admissions, readmissions, and ED visits, three things that hospitals across the country right now are really striving for. Patient portals have been shown to improve patient satisfaction, patient-provider communication, and patient outcomes, mostly because patients finally now have real-time access to the information about themselves without having to jump through hoops to get to it. And this EHR can eliminate common healthcare access barriers, transportation, childcare, work time conflicts, because now with these, electronic healthcare records, with telemedicine, with all of these aspects, no longer do you need to find childcare to get to an appointment. You can have a telehealth appointment instead. Benefits of clinical transparency, so having your notes in real-time access, being promoting patients' trust, patient shared decision making, really putting patients at the center of their care, and patient preparedness and understanding of their visits and before they get to their visits. They now can look back at previous visits and really formulate their own questions. This will increase healthcare literacy and accuracy. Patients reading their notes can see what in fact they have questions about, and if they don't remember something being said, if they never told you they had a history of breast cancer in their family and that's inaccurate, or their medication list isn't accurate anymore, they now have access to all that information so they can help you make their healthcare record accurate so that when you make clinical decisions based off of it, you're making it off accurate information. Patients report being rarely offended in their notes, finding the notes helpful, useful, and that they wouldn't want you to simplify your notes to sacrifice details. They'd rather you just write what you were going to write and they can ask you questions about it. So my main concern was with adolescent patients because ethically there's this big question, what do we do about parental access to confidential information? In a lot of states, teens can share their sexual habits with their provider, their drug uses with their provider, and the provider does not need to tell the parents. But with everyone having access to their notes, how can we protect these teens' information from their parents? And so in a research article, I found that there's a way technologically to mark a note as confidential or not confidential. And when you turn a certain age, you can then make your own account with your healthcare provider, have your own access, and your parents can have proxy access where they can read all of the non-confidential notes, but not the confidential ones. This way, none of your information is being shared without your blessing. Other questions being, what do we do about medication lists? Don't we want those to be private in case there's contraceptives on there that we don't want parents to see? But another big ethical red flag is, what if the parent shares with you something they don't want their child to know about their own child's health? And for that, you'd have to really look into state laws and institutional policies to know how much of that you can keep a secret and at what age are you required by law to share that with the patient. And I feel as though that might become another portion of a confidential note, or you don't put it in the note, it really becomes this giant ethical issue. But needless to say, in the facility I was looking at, they give 13-year-olds their own account. So when you turn 13, you get your own account where you read your own healthcare record, and parent accounts only show non-confidential encounters. That way we're protecting the teen's privacy and really making sure they still trust the healthcare process. Here we have mental health care notes. So basically looking into all of these concerns around mental health care because they're a vulnerable population. Reading the notes can be really jarring if they're not informed. And so I looked at what can providers do with their notes to make sure we're getting desired outcomes with their patients. And that's really how do we maintain that therapeutic relationship? And it's through professional and respectful notes and really highlighting the strengths and progress of your patient. Then, how do we communicate about the notes themselves to your patients? And it's being upfront, being honest, telling them what's written in the note. Even if during a session you say, I'm going to write this in your note, but also being okay with them confronting you about what you wrote in your note and being honest with them. You said this, I wrote this down. This is why I wrote this. And it'll allow them to then clarify in a therapeutic conversation something that you may have misinterpreted. The other thing is embracing the notes to enhance therapeutic conversations. It can help patients remind themselves of the progress that they've made, but also you can include them in your note writing process. At the end of your session, you can say, okay, we talked about X, Y, and Z. I'm going to write X, Y, and Z in your note. I'll see you next week. Now, the other big thing is utilizing clinical decision support systems. So these programs are technological programs through computers to lead clinical practice in the correct direction. And so, in my opinion, we can really use this for flagging notes for adolescent patients before you sign them in case you didn't flag it as confidential or public. Sort of giving you that red flag of you didn't make this selection. That way, providers aren't just signing the notes without thinking, crap, am I supposed to keep this confidential or am I supposed to keep this public? The other thing is auto-populating patients for the year. So when your patient turns 13, auto-populating a sign, have you offered them their own account and confidential information or have you not, if that's something legally you're allowed to do. Other things to note right now, CDSSs are being utilized for after visit summaries for medication lists. So essentially it auto populates in your AVS for your patient. And so my question is, why can't we use it upon initial assessment when you take your first vitals on a patient in the ED or in urgent care? Can there be a population of please review medications with patient? That way you can make sure that medication list is accurate instead of at the end of the visit. And my future recommendations, maybe auto-populating programmed abbreviations at the bottom of notes for patients. That way you as a provider don't have to do that education, but they'll still have that information so that they're still included in that conversation because that would, in fact, sort of improve their healthcare literacy so that they can be a better advocate for themselves. Here we have responding to stakeholders' hesitancies. I really wanted to make a slide sort of addressing all the hesitancies I talked about in the beginning. And what we've learned and what I've seen in research studies is that for the 11% of patients that feel judged with the notes they've read, over 50% felt like they were in control and that control was important to them. 94% felt as though they were accurate, just like depictions of what had been talked about with their providers. 50% shared that they felt the notes built trust between them and the person they were speaking to, and 66% of them felt that when they were looking for a new provider later down the line, having open notes would be important to them and a big part of their decision. There also was research studies that found that opening these notes did not affect the efficiency of care or the workflow in any sort of way in the healthcare field, and that patients reported they'd rather have detail in the notes than simplicity. And so let's not dumb down our notes for our patients, but instead keep it at the clinical standard that we have now, but explain to our patients what those words mean, include them. The privacy concerns, 14% of people were still fearful for their privacy. And listen, all we can do is educate you on security measures. Don't open questionable emails. Don't log in on a public Wi-Fi, X, Y, and Z, but there's only so much you can do. Privacy is what it is going to be. We just have to make sure we have the firewalls in place to protect people's information. My response to the healthcare leaders' fear of creating more healthcare disparities is this is true, but we as healthcare leaders need to address the other inequities so that we can get the patients who would benefit most from this technology, the technology. We need to fight to make sure that people have access to internet. We need to fight to make sure people have access to the technology that they need because truly it's the only way that we can move healthcare into the future and bring all of these people with us. My concluding thoughts: benefits for these patients, they're clear and they're plenty. Having these notes open for them is going to do more good than harm, and educating them is going to be very, very important for success. And education regarding the usage needs to be given not only to the providers, but also to your patients. And equity work needs to be done in terms of access to this information, access to internet, access to technology, access to a smartphone. Privacy will remain a major concern, and we'll need to remember that that's always going to have to be a primary objective of having this technology is we have to protect privacy. We have to protect it as much as we can, especially as the healthcare world moves towards all notes being open for patients to read. And finally, CDSS will become a major factor in creating an efficient and helpful electronic health record when narrated notes, and we really need to get behind that. And these are my references. Thank you.